I want to help you. How can I help you? Like, it's just this natural human thing that we do. You know, you will often get your goals accomplished in the process of helping other people accomplish their goals. But it starts with showing up.
Welcome to the Nonprofit Fundraising Exchange, a podcast from IPM Advancement. Our mission is to help you raise more money so you can make the world a better place. Today's topic, nonprofit collaboration, the power of partnership. More and more, nonprofits are relying on collaboration to advance their mission, especially these days with increased pressure caused by the coronavirus pandemic. Collaboration between nonprofits can provide many advantages to the organizations involved, as well as the communities they serve. In today's podcast episode, we will explore what it takes for nonprofit organizations to work well with others for greater impact. Leading the conversation today is IPM's senior consultant, Rich Frazier. Joining Rich is Dr. Ann Newland and Sam Dean. Dr. Newland is the Chief Executive Officer for North Country Healthcare, the largest federally qualified health center in northern Arizona. Their clinics partner with community agencies to improve the quality and access of healthcare for people across the state. Sam Dean is the executive director of the Scott Family Amazeum in Bentonville, Arkansas. Sam is passionate about working across communities to find ways that allow people to be curious and explore the world around them. He's an experienced nonprofit leader specializing in museum education. Both guests have used collaboration successfully to grow their nonprofits and expand their reach. Take it away, Rich.
Hi, I'm Rich Frazier. I'm Senior Consultant for IPM Advancement. And with me today, I have Dr. Ann Newland, the CEO of North Country Healthcare in Flagstaff, Arizona, and Sam Dean. He's the Executive Director of the Scott Family Amazeum in Bentonville. So now that I've introduced you both, I'd like to give you an opportunity up to about 30 seconds or so to tell us about your organizations for a little bit of context for today's episode. And let's start with you.
So North Country Healthcare is a multi-site federally qualified health center. Our main offices are based in Flagstaff, but we have clinics all along essentially the I-40 corridor in northern Arizona, all the way from the California-Nevada border to the New Mexico border. And we are different from a lot of federally qualified health centers in that we're predominantly rural-based, which means that for many of the communities we serve, we may be the only or just one of a few providers for primary care services. We also provide dental services, physical therapy, and do outreach to special populations, underserved populations, for example, the homeless. This is what I love to do. This is where I've spent my career in the medical safety net, and that's a little bit about North Country.
Awesome. Thank you, Ann. Sam, tell us about the Scott Family Amazeum.
What we have here at the Scott Family Amazeum is a home base for the curious and the creative, a place for people to come. It's part children's museum, part science center, part maker space. More importantly, we think it is a launch pad for folks who want to change their world through big ideas and learning more about each other and what makes the world tick. So we have a physical address, but we think we're located in the hearts of all the folks who want to learn more about the world around them.
Awesome. Thank you. So it's no accident that the two of you are on the show together today because of what you do, and the grandness of what you do requires that you do it beyond yourselves, right? And you have to work with others in order to make the impact that you want to make. So we're talking today about collaborations between nonprofit organizations. And it's something that both of you do very well. But before we get to that, can we start from a more basic place? And that's that collaboration or that partnership that you have with the communities that you serve. And I'm talking about understanding the people, understanding the community needs or issues that have to be addressed. So can we talk a little bit about that and how you go about that? And Sam, I'm going to start with you and the Amazeum and how you talk about and how you do convening of community.
I think one of the things to think about, and I was reflecting back on this idea of convening. And, to me, what I find interesting is that, the word convening, about bringing people together around conversations that matter, is often thought about as an event. We have hosted the convening on blank, the summit of blank. And I think one of the unfortunate things is it presents this idea that bringing people together around conversations is a one-time thing. I think what we like to think about is that if we're embedded in a community, we can't just host an event that brings people together to have a conversation and then it stops there. That informs things. It does not actually help us make change in the world around us. So, for the Amazeum, what we think a lot, yes, we have an address and we talk to our audience that comes to our building, but we talk a lot to our audience that doesn't come to our building. We spend time pulling people together in their backyards, at their community center. It might be at their place of faith. Where are places where people gather that we're pretty sure have an affinity with the kinds of things we're doing? And then how do we make sure that we're showing up for each other in ways that help advance ourselves and our work? And a lot of it is just showing up. By just showing up, we get to build trust. We spend some time together, and that helps build some togetherness. So we think about convening as a process, as an ongoing thing, not as a one-time thing.
Sam, thanks for that. And some of the key takeaways that I took out of that was that it is an ongoing process, right? And it's all about building trust and informing what you're going to do from this point forward. And how does that work for North Country Healthcare then?
Well, one of our requirements for the HRSA is that we have to do community needs assessments. So there's formal and informal ways we do that. Obviously, local hospitals are required to do a community needs assessment, so are local health departments. But even though there's tremendously valuable information that comes out of those documents, they're often a few steps away from the people on the ground, the people who are actually using your services and need your services, our services. So we also have a community board. Our governing board is required to be over 50% users of North Country. So our governance is actually by patients. We also have advisory boards in the communities that we serve. And I encourage the leaders in our organization to participate in other community boards. For example, I'm also on the Flagstaff Shelter Services Board. So that gives me an opportunity to work closely with the main shelter for the homeless here in Flagstaff. And it's a place where we provide services, and it's how you get to know other leaders in the community and hear the voices of community.
That's a real interesting point in terms of serving on other boards of directors. That's sort of an informal collaboration. Does that translate then into formal collaboration somewhere down the road?
So, like Flag Shelter Services is a great example because we have formal collaboration. We bring our mobile unit out to the shelter and right now during COVID-19 to their moteling sites. We've done surveillance testing during COVID-19 for their population and for their staff. We're going to start immunizing next week now that 1B has opened up here in Arizona. So there's formal and then there's the informal ways we work together. And I'll tell you that I leverage that partnership to do even more things. So I've been shopping this paper around town for about a year now on accountable care communities. How can we take a braided approach to funding that combines public funding with insurance plan funding, with maybe some other targeted investments to expand the housing pool here in Flagstaff for low-income individuals. And to do that successfully, I can't do that on my own as North Country, but I can be part of that. And I can be part of that with the shelter. I can be part of that with the behavioral health authorities like the Guidance Center here in town, and then work with city government for CDBG funds. So that's some of the stuff that I want to make happen, but we haven't made happen yet.
I love this idea, and that you're putting out there that, this, or one of the things I'm taking away is this idea of service on other boards is a sense of proprioception as much as partnership, right? It's this idea that you've got nerve clusters that are out there that can understand deeply what's happening, what this intrinsic net around the community is, and it is service, but it's also feeding information back to your own organization to be smarter, faster, more nimble, et cetera. So you get this idea of your antenna are up in ways they can't be up just by showing up at meetings and other things, right? Because board work by itself takes time. It's a long-term commitment. So you're in it for multiple years of learning deeply about this other organization that's doing its own impact field.
Right. It's not a one and done. And I think your description is so on target, Sam, because it's how do you become part of the network of the way your partners do work? How do you as an entity get seen as a resource for ideas, for services? And honestly, some of the biggest help I give to the Flag Shelter Services Board is just that I understand board governance. For a federally qualified health center, we have a lot more structure around the way our board runs as opposed to some smaller nonprofits. And it's a way to help elevate their practice and support them to accomplish what they want to accomplish.
So what leads to some of the more formal collaborations then?
I just hang out with the people that I think are interesting. And so like with Flag Shelter, I have had over the past few years regular breakfasts with their executive director, partly to help support her in her role. And then I read on the side. So I read Health Affairs last April, saw this article, and I'm like, yes, bam, that's what we need to do. But how do we get there? And then how do we as a community generate the momentum to support such a thing? Sometimes you don't have an idea. Sometimes you go into it with an idea. Sometimes the idea just evolves. And then you have to think, how can I create community momentum? You play the long game. This is not a 6-month project and we're done. This is like laying track for years to get it off the ground. But then when you get it off the ground, it's amazing.
Sam, can you give us an example of how you find those formal collaborations?
Sometimes you have an idea that you're looking for other people to help you with. And I think, unfortunately, a lot of people think about partnerships and that is their prime mode. I have a thing I want to do. I want your help to help me on my idea. I think there's great power in doing just what Ann was speaking. We've had a number of partners who are like, hey, I've got a problem I got to figure out. And we just show up and say, hey, how do we help do barn raising with you? And there may be a contract involved. There may be money exchanged. There may not be money exchanged. It may be this is just the way we want to be with our neighbors. It may be, hey, we know that right now that you don't have funding, but maybe down the road you'll have funding. This will help you get funding. Let me help you help us. And so there are lots of different modalities. And I think if you're willing to shift between those and have the freedom to shift between those, it lets you read situations and be able to do the things that are opportunistically beneficial for the most amount of people. And then sometimes you have this glorious moment where you actually have funding to do something, and then you get to invite people into a funded project. And those are the beautiful ones. I wish those happen a little bit more often than they do, because when they do happen, it does feel like there's a wonderful moment for all to celebrate. But I think showing up for people, being able to read scenarios, being able to contribute to other people's work as well as your own, and this give and take just reinforces these cross ties, right? And these cross ties are the ones that enable you to get across things like the pandemic we're under. I mean, the ups and the downs, there are a lot of ups, but when you hit those downs, you need something that can help bridge from one edge of the valley to the next.
Money is one way that we bridge, but sometimes you just need that social support of the people who are fighting the good fight. And then when you get the money, more people take your calls.
Sometimes you just need that moment where someone can say, hey, that person's idea is a really good idea. You should listen to them, right? Like one person standing alone is, kind of can be strange. Once the second person stands next to them, all of a sudden now you get the beginnings of a party, right? And other people want to join the party.
Absolutely.
So what would you say to that executive director or that development director out there that doesn't know how to show up, doesn't know how to make those connections? How do you advise that person?
I think it goes back to having genuine interest in other people, interest in what they're struggling with, interest in what they want to do. I don't know if it was you who told me this, Rich. If you want money, ask for advice. And if you want advice, ask for money. I think that was you.
I might have said that a time or two.
You might have said that to me once or twice. But it's really true. Like if you go into something with the notion that I really want to learn more things come out of the tree than you could ever imagine. Connections, ideas, and honestly, sources of funding.
And I think those of us who are in the nonprofit sector, we're in it because we believe in this common good, right? And, I remember, being a development director or being an executive director and sitting around a table, just brown bagging it with other nonprofit leaders and discussing what's going on in our community and how can we make an impact there? How can we work together? And for me, that is a common conversation starter. How can we work together to do something better in this community?
Rich, I think I've got two thoughts. One is, depending on the size of your organization, I think we're a small enough organization. We're a little under $5 million a year budget, under maybe 84 people. So we're relatively small. So I think about small businesses and I think about entrepreneurs, and there's this element of hustle. So like if you're new and trying to figure out, like if you're moving into a leadership position, I found out a lot just by going to chamber events and other places where people, for their sheer existence of a for-profit business, have learned how to do the hustle. They've learned to talk to each other. They've had to. That's the way they're building their business. And I've learned a lot just by being around people who do this very thoughtfully and strategically. I think the second one is learn how to make that turn from that, how might we work together, to, okay, now let's do it. And that moment from conjecture to action is an interesting inflection. And what does it take to move from a cool idea to, okay, this is actionable now.
Yeah.
Let's how do we actually gain traction around this and move forward? And what are the barriers to moving forward to this greater impact? And I think both of those are ones that are really interesting to study around people who do that really well.
Let's talk about the advantages of partnering with other nonprofits, the advantage to the nonprofits themselves, the advantage to the communities.
Well, I would say you don't have to be the expert at everything. There's some things that North Country does super well, and there are other things that we don't have expertise in. There's another community partner that has that skill set or expertise, but by working together, we amplify each other's message. It goes back to what Sam was saying. One person shouting in the wilderness, doesn't make a very, very loud noise, but you start bringing a partner there, you start getting 3 people there, and before you know it, you've got a party that's really spreading what you're trying to accomplish.
So it's really kind of knowing your lane and doing that and bringing along other people to do the rest then, right?
Yes.
At the end of the day, we're trying to change the world. And if we're thinking about changing the world, and even if we can only influence a corner of it, we know we have to work with other people to change the world. So we might as well accept it as just a part of our core way of working, right? Otherwise, I think we're not fulfilling the potential of what we could be and what we want to be. I think we'll always be held back if we're not inviting people in to contribute to their work and have them contribute to ours. This amplifying effect only works if we are able to work with others to change what is happening, around everywhere around us. Anyway, I keep going around the world. Okay, that seems really large, but even regionally, right? We can only see so many people, and yet we can amplify each other's work by having these messages going out at multiple points, at libraries, at other museums, at schools and after schools and boys and girls clubs and YMCAs, et cetera. Boy, when we all work together, that's a lot of impact that's done together.
Do you find yourself at risk then of mission creep and having to rein in all of the great ideas that come out of these collaborative brainstorming sessions?
I know that we have to be very disciplined to decide what we're not going to chase. And I think sometimes in the nonprofit world, you can chase money for programs because you're trying to keep yourself alive, but then you drift away from your core mission. And we are lucky to be in a position where we can decide, no, we're not going to chase that money. Maybe 15 years ago, we would have chased a project, but it's going to take us too far away from what we need to do, or the reporting requirements are too onerous. It doesn't cover enough positions. And I'm sure Sam has a take on that as well.
Sometimes program evolution to some people feels like mission creep. And internally, it's really getting back to our core values that just because we did a program when we started 5 years later, doesn't mean that program actually is helping us advance our mission. Maybe we have a different program that is better for it. So it leads to a lot of existential questions of like, well, if our program changes, is that okay? Is that a thoughtful and intentional change, or is it a reactionary change? And is it so really kind of figuring out, Jim Collins talks about how do you preserve the core but stimulate progress, both sides of a coin. And what are the things that are immutable over time? And what are the things that we expect to change and drift, and making sure that those two stay in lockstep with each other? So I give you not an answer, I give you an existential questions that we ask ourselves, like, is this program still in alignment with who we are? And sure as heck, every grant that we apply for, does this take us in a direction we don't want to go? And boy, that's the toughest question, is when someone tells you to do something and funds it, what if it's not in alignment with where you want to be?
Let's go down that path a little bit. Grant funders, they love to encourage nonprofits to work together, to collaborate, and they like to throw money at that. And sometimes this is referred to as shotgun nonprofit marriages. What are the pros and cons here? Because I think that we've all seen this happen, and we've seen the good come out of it, but we've all seen sort of some bad partnerships come out of this. So, funder encouraged collaborations. What do we think?
So not every collaboration is a good collaboration. And I always do think of these things like a dating metaphor. Like, do we want to spend time together? Because if you're getting into a 3-year grant or a 5-year grant with somebody, you're going to spend a lot of time with them. So there has to be a lot of trust. And sometimes you might start a grant project and make sure that it's small enough so that you have time to develop that trust, so that you're not so financially dependent on that grant that you can't, maybe dial up or dial down your commitment. On my mind right now is a grant opportunity that we just walked away from. This was a very intriguing opportunity. It aligned with some of the work that we've done around substance use disorders. But at the end of the day, my team is spread so thin that we can't fully commit to this. Maybe in 2 years, we would be able to commit to it and then really work to develop the trust that's needed to have a successful program. But I think that just as you look at this opportunity, you have to do a lot of introspection. Can I really take this on? Because if you're not able to step into the partnership without a lot of your fingers behind your back, crossing your fingers, like, well, I don't know that I'll really be able to do that. Like, that doesn't feel good. You should be able to jump in feet first. Yes, we're in it and we're going to make this work together.
So a lot of being honest with yourself there. Mm-hmm. Sam?
I feel like I had a resonance tuning fork moment, and as you were making all of your comments there, it's actually having the discipline to be able to walk away. I think is one of the savviest things a leader can do, is know when no is the right answer. I'm gonna speak out of both sides of my mouth, so I admit that up front. I think from a funder's perspective, pushing grantees and folks that you're supporting in the community to collaborate and work together is the absolute right thing to do. I think working together is hard. And I think if we all agree that working collaboratively in a community is important for impact, if an organization is not collaborating in a broad sense, there's something wrong going on, and there really should be a diagnostic as to what's happening. It is rare you are in a lane that doesn't have other people who are directly attached to it. We have worked with organizations that literally are serving the same families, and have never around almost the same issue and have never spoken to each other as organizations. Like that's a challenge, right? So we are happy to be a convener of the conversation and bring folks together and allow things to happen. I think the challenge gets is when it becomes very prescriptive of not only do you need to work with partners, you need to work with these specific partners. And so when you talk about specific partners, well, then that becomes a bit that doesn't acknowledge the finities of individual situations and what's happening. So I think on a broad scale, yeah, if places aren't collaborating, I think from a funding perspective, you might say that are you doing your best work and are you the best investment for funds?
Right. Sam, I want to zero in on something that you said about multiple organizations maybe working with the same families. And when Sam said that, I saw you nod in agreement. So you clearly both have seen that happen. Why does that happen? Why are organizations not talking to one another?
I mean, I think there's one thing, and I'll speak from, and we are a small nonprofit, but we are not as small as many nonprofits are 1 and 2 and 3 and 4 people large, right? So if you look at the hours in a day or a week that you have to spend, a good chunk of it needs to be focused directly on the work. And then you have all these other administrative things that have to happen. And often, remember my first days here when there were 2 of us in the office, right? And it was like, okay, who's going to go to the bank today? Like, I guess it's Sam's turn. Who's taking out the trash? Sam's turn today. And so I understood. So from one perspective, there's this, your capacity is limited in your ability to reach out. So there are capacity limits that I think are a major barrier to things happening. In fact, in many ways, I would say that's why funders who offer opportunities to provide layered on services, HR, finance, et cetera, that can remove those barriers from particularly very small nonprofits that just really could use that expertise and shouldn't have to be fundraising themselves to be able to fulfill some of these things that so many other people are good at, can help remove those kind of day-to-day things to allow time for more collaboration, et cetera. But I think size is a really big factor that makes it really hard to collaborate.
Sometimes different groups are very wedded to a certain model of service delivery. And kind of the frame that they bring precludes certain types of collaboration because it's not terribly flexible.
This is the way we've always done it.
Yeah, it's the way we've always done it. And I think people get very attached to their experience. One of the things that's hard for people, especially as they've moved on professionally, maybe they launched a nonprofit, now somebody else is running it. They have a hard time seeing that their experience has become irrelevant to the organization as it is now, or where the organization needs to go to be sustainable. And community needs may have changed, funding opportunities may have changed. There may be other programs that are providing a similar service. So how do we pivot and do something different? Those are deep questions for some community leaders, and it can be very hard to let go of how you've always done things.
Let's talk about some of those organizations that might be wanting to break out of that mold of how we've always done things. And maybe we're a 2 to 4 person shop and bandwidth is an issue. What kind of advice would you give to those organizations to get into collaborating and partnering with other organizations to expand what they're able to do and the impact they're able to have?
I would be very deliberate about meeting with other community leaders for coffee at least once a month. And I would challenge people to come up with a once every 2 weeks or once a week of intentional sitting down with somebody. And the goal should be to listen more than you talk.
I think I love what you're saying, Ann, too. Like, set a goal. And I might take that one further, like put it in your own metrics or measurement. If you're not someone who normally thinks about connecting for coffees and doing other things, if that isn't naturally part of your workflow, that's not naturally how you're kind of wired to tick. What is the thing that holds you accountable to it? Set your goal for, I'm going to do 4 conversations this month with leaders around the community, and I'm going to hold myself accountable to it. In fact, I'll put it in my performance evaluation plan with my board, if that's who you report to, or my senior leader who I report to. Because if you value it enough to put it in how you're holding yourself accountable, you're going to do it. And I think you'll see dividends from it. And I also love this idea, like, show up and help other people with their problems, like show up and help other people with their work. Because sure as heck, we are a species that loves reciprocity. We love to give and take. We love to be able to contribute back. The number of times, I think I've met with people who have been asking for things around board service and other things. The moment we end the conversation and they say, I want to help you. How can I help you? Like, it's just this natural human thing that we do. You will often get your goals accomplished in the process of helping other people accomplish their goals. But it starts with showing up and holding yourself accountable to show up.
Hi, this is Curtis from IPM Advancement jumping in for a moment. If you're a nonprofit professional who has questions about your program, or maybe you feel like you've taken your advocacy, fundraising, or membership effort as far as you can and you need some fresh ideas, we have a special offer for you today. NPFX podcast listeners can get a free 30-minute consultation with IPM, no strings attached, when you go to ipmadvancement.com/free. Just enter a few details and an IPM team member will contact you to follow up. It's that easy. That website again is ipmadvancement.com/free. Thanks for listening, and we hope to talk to you soon. Now let's return to the episode.
We're going to start the final round of questions, and I'd like to give each of you an opportunity to share an example of a successful collaboration that you were involved in and how that benefited the communities that you serve, how it benefited your organization. And by contrast, perhaps, if you don't mind, sharing a collaboration that maybe didn't work out so well and what lessons that you took away from that.
You know, we're part of a network called the Arkansas Discovery Network, which was funded by the Reynolds Foundation to support a network of museums across Arkansas in a number of methods in terms of increasing capacity for museums to offer STEM-rich learning opportunities. So we built this museum and we joined this network that allowed us to join even before we built our museum, right? We were helping design exhibits, even when, you know, there wasn't necessarily a place for us to show them. And I think, you know, this statewide network of very different museums, a Museum of Natural Resources, a traditional science center, a museum associated with the university up in Jonesboro, people put aside the time to build this togetherness that pay dividends in each one of these communities. And we struggled through a lot of things because we are very different organizations. But this network, this moment of time we put together all across the state has led to, I would argue, a 3x increase in the amount of high quality STEM-rich opportunities for kids and families around the state. Anyway, the investment of time over time, and co-developing things and being willing to do things that sometimes you're paid for, sometimes you're not, and you just sort of figure out ways to negotiate it, has really led in Arkansas to some really powerful impacts in not just the larger communities, but in many of the far-flung rural communities at the edges of the state.
And before I get to you, I want to pick on Sam because I asked also for a collaboration, if you don't mind sharing, Sam, that perhaps didn't work and any lessons learned from that.
You know, we worked with a school here that we invested a lot of time in and building a whole faculty that was dedicated to making and tinkering, something that we hold to be pretty clear, working with your hands. And, you know, they had faculty turnover, and the turnover meant almost every faculty member left within a very short period of time. And so in some ways, it feels like all of that work we poured into that organization just disappeared. And it disappeared overnight. And then with administrative change, we're not in contact with them really all that much. So we've seeded other schools now who have those faculty, but the organizational level kind of relationship just is no longer there. And that's one of the risks that we have all the time, is that when you partner for long periods of time with folks, people, when you have a turnover, if everything disappears, it can be very deflating to feel all this work we did to have impact hasn't led to the kind of impact in that community that we'd like to see. Sometimes it just means we have to look at the impact we've had in a different way. Sometimes it means we have to reinvest in that place. Sometimes we are the actual living memory that helps replug this hard drive into an organization that is restarting from scratch. So there are positives to that, but boy, that's the worst feeling when you look at an organization, you're so proud of the work you've done together, and everyone is just gone after that.
But I think that's one of the lessons to learn from collaborating, in that there is inherent risk in it. And we need to be willing to accept that and willing to accept the lessons learned from that. Anne.
The program that I'll highlight as a really interesting collaboration and very successful collaboration is called NACASA. And it stands for the Northern Arizona Care and Services After Sexual Assault. This was is a collaboration between North Country, the county health departments in a couple of counties here in northern Arizona and the local emergency department, so that after people have experienced an assault, they'll get their forensic examination done at our health center rather than in the emergency department. We have specially trained nurses and nurse practitioners who do the exam and collect the forensic evidence. And the environment, when you can have that done in your community health center, is less rushed. We can do this in a very protected, thoughtful way. There's a little antechamber before you go into the room. So if law enforcement is there, they can sit in that space. They're outside of the clinic flow. And the room is a little bit bigger and it's got no windows, which when somebody's having an intimate exam is really an advantage. And behind the area where normally somebody would be working to snap the x-rays, we've got a closet of clothes, because oftentimes people's clothes have to be taken for forensic evidence, and they can bathe at the facility and get a completely new, fresh outfit. Mm-hmm. So that's something that feels really good and is very different from the way forensic exams are done nationwide, and allows us to have it in a more humanized environment. That's a collaboration I'm super proud of and really makes a difference for a lot of people. When I think of one that didn't work out so well, the first time we bought a mobile medical unit was with the eye that we were going to provide services at the schools. And we had some grant funding, and they bought this gigantic boat anchor. It was like $450,000. It's a very expensive thing with a slide out, and you could have done dental in it. I mean, it was beautiful and very expensive to operate. And it broke down a lot, as anybody who's had a recreational vehicle knows. So it spent a lot of time in the shop. And honestly, our collaboration with the school district here in Flagstaff was not sufficiently robust. So at least with the school board that was in at that time, we were not allowed to talk about reproductive health services or sexually transmitted infections. And, if you are working in a school, I'm a pediatrician and an internist and did school-based services for years. About 80% of your visits are for sexually transmitted infections and to talk about birth control. And relationship stuff, depression and relationship stuff. So if you can't talk about those things, it makes it really hard to reach kids who need you. So we had this expensive resource that was underutilized and weren't able to offer the range of services that we would have most wanted to offer. And eventually we just decided, we're going to get rid of the mobile unit. And there was much weeping and gnashing of teeth in Flagstaff for the people who loved the unit when we made that decision. But we replaced it with something that is more like a Sprinter van, so very small, very efficient. You don't have to have a commercial driver's license to get it around. So it's easy to take around town. We can park it at our main site, and so we don't have these storage expenses. And you know what? It doesn't break down. That thing works. And we've been able to see so many more people. So part of the problem was the partnership. But part of the problem was also the model we were trying to force on the partnership.
Good lessons. So go ahead, Sam.
Okay, I'll reveal one more, and it's a general class of things. And it's I have funding and a really good idea for an exhibit. And rarely does one lead to two. In fact, I can't even count on my hands the number of times what would make a really great exhibit? If you just blank. Anyway, so I always think that some of the partnership sponsorships that can roll about, and it starts with, I have an idea of, rarely does that actually lead to something that people want to see.
Okay.
Not all ideas are good ideas. And sometimes the enthusiasm for the idea is inversely proportional to the quality of the idea.
Next to last question. what would you like listeners to most take away from this conversation?
Put yourself out there, make friends, and listen.
Sam.
We're all on this journey together. Find the things you love to do, find the things you're passionate about, and support the spectrum of things that are enabling those things to happen.
Perfect. Thank you. Ann Newland, where can listeners learn more about North Country Healthcare, and what's the biggest thing you want them to know right now?
So North Country Healthcare, we've got a presence on the internet, northcountryhealthcare.org, and you'll see little postings and videos and things like that. Probably the biggest thing we're doing right now is advancing our family medicine residency program. And I'm pushing through with others some legislation with the Arizona legislature to create a funding pathway for community-based primary care residencies. And here in Arizona, psychiatry is included in primary care. So this is the thing that will fundamentally change graduate medical education in Arizona, and I think will inspire other states down the line.
And let me just stick in here that this is a perfect example of you collaborating with a whole lot of others to get this legislation passed. Sam Dean, where can listeners find out more about the Scott Family Amazeum, and what's the biggest thing you want them to know right now?
Well, if you want to learn more about the Scott Family Amazeum, go to our website, www.amazeum, AMAZEUM.org. But don't just learn more about us. Take the Amazeum into your home. There's Amazeum U. It's a curriculum online with videos and other ideas of how to do science in ways that are led by our play facilitators, some by me in very quirky ways during the pandemic out of my kitchen. We think this, again, humans are questioning beings, right? So wherever you are, whenever you are, look for opportunities to explore the world around you. Support the Amazeum if you're here in Northwest Arkansas. Find your local children's museum, science center. Support it wherever you are. Make it a part of your kids' daily, weekly, monthly itineraries, and stay curious yourself. Kids resonate strongly with what they see around them. And when they see you be curious, it makes them even more wondrous about the world around them.
So this is where I really wish sometimes this podcast was a video podcast, just so everybody could see the giant smiles on the faces right now. You two, Ann and Sam, are two of my not just dearest clients, but also two of my dearest friends. And I appreciate the two of you being on together, because I really appreciate the work that both of your organizations do and the way that both of you lead your organizations. So thank you very much.
That wraps up our conversation on nonprofit collaboration. Thanks to Rich, Ann, and Sam for sharing their insights and expertise. If you'd like to learn more about our guests and the organizations they represent, we'll include that information in the show notes, along with any other resources that were mentioned today. If you like this episode, please subscribe in Apple Podcasts, Spotify, Google Podcasts, Stitcher, or your favorite podcast app, and leave us a review. The best way you can help us reach more nonprofit professionals like yourself is to post a positive review or share this episode with your network. We appreciate your help spreading the word. We also invite you to explore our growing library of white papers, infographics, and articles in the Learn section of the IPM website. That address is ipmadvancement.com/learn. Thanks for listening, and we'll see you next time.